Joshua, I want to just thank you so much for that, excellent presentation to all of us. I want to introduce our next speaker. I'm going to try to keep moving this conference along as quickly as we can. And I want to introduce Richard Doerflinger. I know, I would imagine most of you already know Richard and all the great work that he has done for the church and for all of society in defending life. He's been the feet on the ground, for all of us for so many years. And I'm honored to be, welcome Richard now. If I went through his resume, it would take me as long as he's got to talk. So I'm going to turn it right over to him. Richard. Thank you, Richard, for being here. Thank you.
Hi, I'm from Washington, and I'm here to help you.
How much is that going to cost?
It's funnier every year. The purpose of my talk is threefold. First, I want to run through what the current federal laws do to protect the rights of conscience for Catholic and other healthcare providers. How do they provide a level playing field, not to impose Catholic or any other morality on the field, but rather to leave us free to practice medicine and heal in accord with life-affirming values that Catholic healthcare promotes. Secondly, I want to explain why those laws, though on paper they look rather impressive and they look like they're pretty good, actually have quite a few deficiencies, flaws, loopholes, limitations that allow the challenges against the rights of conscience continue to operate. And finally, some solutions we're trying to bring to some of those problems through new legislation. So without further ado, I'm going to sort of plunge right into what are the current federal laws. There are quite a few, and I'm not going to go through all of them, but these are the three major ones. There's a handout. Is the handout? Oh, the handout needed to be, sorry. There's a handout that has a chart of some details about these laws and also refers you to a website on our page on our website where you can, if you're having trouble sleeping at night, 8 pages, single-spaced of legislative text. When you're, of all the different conscience laws in federal law, and when you're finished with that, you'll understand why we have no known congressmen poets. The first, the oldest, is called the Church Amendment, not because it helps the Catholic Church, but because it's named after its sponsor, Senator Frank Church of Idaho, and was passed in 1973, and was added on to later on in 74 and so on. There's the Coat Snow Amendment, responding to a threat against medical residency training programs, particularly in OBGYN. And there's the Hyde-Weldon Amendment, which is a rider to annual appropriations bills for the labor and HHS departments, which was enacted in 2004, but needs to be renewed every year in order to keep its effect. Let's see. What? I'm holding the wrong device here. Okay. First, the Church Amendment. As I said, Frank Church. It was approved in 1973 to respond to two threats. One was simply the Supreme Court's handing down of the Roe versus Wade abortion decision. And right away, people started saying maybe conscience clauses against abortion are no longer even constitutional or appropriate. Hospitals, clinics, and so on began doing abortions, and right away the issue arose of what are the rights of those in those institutions who do not want to take part, who have conscientious objections. And Congress was asked to step in on that. The Bishops' Conference was very involved in calling for legislation like this. And the second was a federal district court ruling in Montana that said a Catholic hospital in Montana, which was the only major hospital in the area, because it received federal funds, had a positive obligation to provide sterilizations for that area. That because you received the federal funds, you are in effect a state actor, you're an arm of the federal government, despite the fact that you're a church-affiliated hospital, and you must provide whatever things the federal funds provide reimbursement for. And needed response as well. Church amendment has several subsections. It goes on for about 3 pages just by itself. I'm just going to review this quickly because it does get complex. There is no subsection A anymore. That used to say something and got deleted, so I'll start with subsection B. This is not a quote, but a paraphrase. Receipt of federal funds under certain federal programs which are specified, Public Health Service Act, Mental Health Facilities Construction Act, and so on, may not be used by a court or another public authority to force an individual or an institution to take part in sterilization against his or her moral and religious convictions. So it doesn't say nobody else can force you to do that. It just says the receipt of these federal funds may not be used by a public authority to force you that way. And that responded to the Montana sterilization case. Subsection C1 talks about entities that receive those federal funds not discriminating in employment and so on against individuals in the institution. And it's double-edged. It says who are willing or unwilling to take part in abortions or sterilizations on moral or religious grounds. That double-sided protection was added during the debate on this legislation by Senators Ted Kennedy and Jacob Javits, who said, well, if you're going to protect guys who won't do abortions, you need to protect those who will as well. And so ever since, Catholic hospitals as well have operated under this requirement, and it becomes a scandal in some local community to say, why is the local abortionist the head of OBGYN for the Catholic hospital? And the Catholic hospital doesn't have much recourse because he's protected. We can keep him from doing abortions or abortion-related activity while working with us and while on our premises, but not we can't say he doesn't qualify for that promotion in that position because he's willing to do them or does them elsewhere. Subsection E of the Church Amendment has those same protections for applicants for training or study. I hear all the time about medical students who are getting asked about whether they're willing to perform abortions. The right answer to that question is, legally, why do you need to know? Because they are not allowed to do anything to you based on the answer to that question. They have to accept you, they cannot reject you for admission based on your unwillingness or your willingness to do abortions or sterilizations. Subsection D is probably the most helpful in theory, and it's not widely known, because this goes far beyond abortion or even sterilization. You have a health service program or a research activity that gets funds under a program administered by HHS. You cannot be required to perform or assist in any part of that program that is contrary to your religious beliefs or moral convictions. So this is independent of what the procedure is. It only applies to if you're working in a program that is getting federal funds, research or medical service. So that's the Church Amendment. As you can see, it mainly has to do with the rights of entities not to be forced by government to do certain things, and if those entities receive certain kinds of federal funds, their obligation to respect conscience rights in privileges in employment and training. Now there's the Coates-Snow Amendment. This was Senators Dan Coates and Olympia Snow. 1996, Congress had to respond to an effort by the Accreditation Council for Graduate Medical Education, which has representation from the Association of American Medical Colleges, AMA, ACOG, and so on, to require all OBGYN residency programs to provide abortion training. And that's a huge issue, since if you lose accreditation because you don't provide abortion training, or if you went to a program that doesn't do training, or you didn't take the training, you could find yourself without accreditation and therefore not seen as a valid program, for example, to receive federal funds under federal rules. So the Snowes-Coe Amendment said that no federal agency or program, no state or local government that gets federal health care funds can discriminate against individual or institutional provider because that provider does not provide abortion or abortion training, did not receive such training or does not refer for or pay for such abortions or training. That sounds very expansive. It's been interpreted narrowly since, and that's one of the problems I'm going to be talking about. Finally, the Hyde-Weldon Amendment. This was first passed in 2004 as an appropriations rider. When limitations became apparent in the Coates-Snow Amendment, the actual effort in Congress was to pass something called the Abortion Non-Discrimination Act in 2002, so that it would clearly apply to all kinds of healthcare providers and to protecting people who refuse to get involved in abortion in any context, including non-training contexts outside of residency programs. And that passed the House, but was never taken up in the Senate. So we had to sort of retool and figure out how to get some of this protection into law. We reframed it as an appropriations rider, passed it as an amendment to an appropriations bill that the Senate couldn't really refuse to act on without closing down the government. That used to be less popular than it is now, I don't know. So they swallowed it, they took it. This was named for Henry Hyde, because this Hyde-Weldon Amendment was added as an extra subsection to the Hyde Amendment that has barred federal funding of abortion in the labor HHS appropriations bill since 1976. And Representative Dave Weldon, a doctor from Florida, who was its prime sponsor. Now this is actual language here, but what it basically says, it's very similar to Coates-Snow, but it's more expansive in its scope, because it says that none of the funds in this act, the Labor HHS Appropriations Act, can go to a federal agency or program or a state or local government if that governmental entity subjects any institutional or individual healthcare entity to discrimination because that entity does not provide, pay for, provide coverage of, or refer for abortions. So that clearly refers to any pressure to perform abortions, whether in a training program or not. And then healthcare entity got a broader definition to explicitly cover all kinds of health professionals, hospital, provider-sponsored organization, HMO, health plan, and so on. Because previously, the Coates-Snow Amendment had been interpreted as mainly just applying to training and residency programs. So this has been extremely helpful on the abortion issue. Note that it only bars discrimination by the government. It does not help you if the discriminating agent is a private hospital, for example. But it's trying to rein in the government itself and saying it cannot pass laws that apply to make someone do an abortion against their will. And yet the challenges continue. American College of Obstetricians and Gynecologists in 2007 did an ethics committee opinion that says, it's called the limits of conscientious objection. Once you get done with the limits, there's actually nothing left of conscientious objection. And they put this out as an ethics opinion, and the great danger here is that ACOG ethics standards tend to get worked into the accreditation or certification standards by their sister organization, the American Board of OBGYN. And this opinion on limits of conscientious objection, among other things, say, if there's something you will not perform, like abortion, then you still have an obligation to do a referral for that. If there's nobody to refer for, then you still have to do it. And by the way, in terms of referrals, you really should locate your practice near the abortion clinic to make sure that access from you to the abortionist will be extra easy. You still have a conscience, but it's all in your head. You know, basically, it cannot affect your actual activity. So thank you, ACOG. And that ethics committee opinion was, that sent sort of a wake-up call across Catholic physicians groups and so on. The Bush administration put out regulations to more effectively enforce the existing conscience laws, and that was put out at the end of 2008, and was originally it was called into question by the Obama administration, has now been rescinded and replaced by something weaker, though I want to say later that there is still something to build on in the Obama regulation even. But this is something that continues to be out there. They actually reaffirmed this ethics opinion in 2010, despite the protests from many doctors, including members of ACOG, it has not gone away. There was a case recently in Mount Sinai Hospital in New York where a nurse named DiCarlo was forced to take part in an abortion at 22 weeks, although she had previously filed a written certification with the hospital that she would not assist in abortions. They had told her that would be respected. And then when staffing got tight and so on, they said, well, that's, this is the limitation on your conscientious objection. And they actually made her become the nurse that had to count the body parts on the table to make sure they were all out. Had nightmares ever since, and ended up trying to go to court, and ended up being told that the statute you were trying to sue under doesn't allow you to go to court, and her case remains in somewhere in the Office for Civil Rights at HHS. There's a case at Vanderbilt University where for years, apparently, they had a program for nurses who want to train in women's health care, that those nurses would have to assist in abortions. They didn't even know there was a law that said anything that was, counter to that. The state government in California, and I'm so glad that Bishop Basha is there now because I have great hopes that they will now back down. But, California seems to be a real center for activity against conscience. And the Department of Managed Care in California has been telling Catholic health plans that every plan in the state, they're interpreting current state laws requiring every health plan in the state, every managed care plan to cover abortions. Only medically necessary abortions, which means health, which in the abortion context means social and emotional well-being. And they say there's nothing in federal law that stops them from doing this. And of course, there's the Patient Protection and Affordable Care Act, the Health Care Reform Law, PACA. There are a number of problems with PACA in the abortion I'm not going to talk really about the abortion funding provisions, which we've been trying to do something about. But there are conscience problems as well. There's an overall general problem with requiring taxpayers to fund abortions, of course. Most taxpayers are against that and object to it, and that's a conscience problem in its own right. But more specifically, in the health care reform law, if you enroll in a health care plan that is on these new state exchanges and is getting federal funds, and you want to say, I don't want to have to pay for other people's abortions, the law actually requires the health plan to turn you down. It's not a matter of just, a lot of health plans like to put abortion in their coverage. They think it's cheaper than paying for childbirth. But here's the first time the federal government is actually telling the health plans, once you've chosen to provide abortion, each and every enrollee in the plan must pay for those other people's abortions. There must be no exceptions. It's actually forbidding them to respect conscience. Second thing about PACA is none of the new governmental entities set up by the law are covered by the Hyde-Weldon Amendment because there are billions of new dollars in this legislation that are appropriated outside the bounds of the usual appropriations bills. So it's not covered by the appropriations bill. It's not covered by the policy rider that covers the appropriations bill. It has no Hyde-Weldon Amendment of its own. It used to on the House side. In fact, it was not even part of the Stupak Amendment because even before the House health care bill got to the House floor to be amended by the Stupak Amendment, the Hyde-Weldon language on conscience had already been accepted by voice vote in committee, chaired by the most pro-abortion member of the House, Henry Waxman. And he had said, yeah, we'll accept that. That's current law. And in the end, on the Senate side, we didn't even get that. And that was something that had been accepted in the House without controversy. But it's not there anymore. It needs to be put back in. Thirdly, there is a conscience clause in the law on abortion, but it only says that health plans on these exchanges, the health plans themselves may not discriminate against an individual provider in the plan or an institution in the plan that does not do abortions. But there's no protection there against the governmental entities themselves saying that all health plans have to do this or that providers working in the other government programs set up by this must take part. And finally, the Healthcare Reform Act does something the federal government has never done before. It's actually produced two different lists of what is going to be mandated as a service in every health plan in the country. There's one list called Essential Health Benefits that will have to be in every qualified health plan that can participate on these new healthcare exchanges. And there's a separate list added late in the process in the Senate by Senator Mikulski called Preventive Services. And that has a subset, a list that is specifically for preventive services for women. And there's no conscientious objection or conscientious exemption written into either of those. And finally, and this is something that has become very contentious in trying to put new legislation through in Congress, there's this section 1303D. 1303 is the section of the Health Care Act that deals with abortion. It says, nothing in this act shall be construed to relieve any health care provider from providing emergency services as required by state or federal law, including the federal law known as EMTALA, the Emergency Medical Treatment and Active Labor Act. Now, EMTALA has never been used to require people to do abortions. In fact, it talks about emergency rooms that are not going to be able to keep a patient as an inpatient to stabilize the condition of her and her unborn child if she is pregnant. But the ACLU and other groups have been trying for years, and they have letters before the Department of Health and Human Services now, insisting that EMTALA should be used against any hospital that will not provide an abortion in what ACLU calls emergency cases. They define emergency as anything that will save life or health. Definition given already above of health. So this says if there is going to be any conscience protection in this law, that will still be trumped by anything that a state or federal law decides to define as an emergency. So it's just like ACOG that limits on conscientious objection, which means potentially complete nullification of conscience protection. So all a state has to do to trump any conscience protections that could be in the law is to say abortion is an emergency. You know, we know emergency contraception already. That means emergency contraception is there was unprotected intercourse, or a condom broke, or somebody forgot to take a pill, and somebody that really doesn't want to be pregnant right now. That's an emergency. Abortion can be defined the same way. So the deficiencies are many. There's limited scope. Some of them only cover certain funding avenues. They only cover certain procedures, most often just abortion. Church amendment, you have sterilization. In some subsections of church, you cover things beyond abortion and sterilization. You have undefined terms that make the scope unclear. There's no definition in these laws of abortion or sterilization, or of what it means to participate in the church amendment in the performance of these procedures. How close does that participation have to be? Is the nurse covered who did not actually hold any instruments but had to count the parts while they were doing the procedure? These are sort of left open. The enforcement mechanism is unclear. For the most part, these laws don't say exactly how you get your rights vindicated. Now, the one thing that is good that the Obama regulation has left in place is that these laws, all of them, can be enforced by filing a complaint with the HHS Office for Civil Rights, which unfortunately is a rather overworked agency. But at least you have that recourse. None of them says anything about a private right of action. In other words, an ability that you may have to get a lawyer and actually go to court and get the law enforced against those who are discriminating against you, to sue for your rights directly, just in case you don't want to wait 2 or 3 years for the HHS to act. The remedy under Hyde-Weldon, because Hyde-Weldon was written as an appropriations rider, it starts out with no funds under this act may go to an agency that discriminates. You always have to state that as a limitation on funds rather than as a statement of legislative policy. The result of that is the only implied remedy for a violation is to go to the state of California, for example, and to say, you just lost all of your Medicaid, Medicare, every HHS funding stream, education, and labor. And the state of California is saying, nobody will ever do that to us. This is like the doomsday device. This is an attempt at nuclear deterrence, but you'll never drop the bomb on us. That would be billions of dollars. The whole state would crumble and you'd be blamed for it. So they're thumbing their noses actually at the federal government on this and saying, because Hyde-Weldon's only remedy is too ambitious, it's unconvincing. And finally, the Department of Managed Care in California is saying that this just says that if the state gets federal money, that part of the state can't discriminate, but the Department of Managed Care itself does not directly get federal funds, so we're not even covered by Hyde-Weldon anyway. And they think they can make that stand up in court. So, solutions. Actually, that's the wrong side. Should be plural, solutions. One of them, and I'm just going to go through this very quick, I'm just about out of time. The Protect Life Act, these are all listed on your handouts there too. Pitts-Lipinski bill, this would amend the Health Care Reform Act to restore what used to be the Stupak Amendment, the Hyde policies on funding, put the Hyde-Weldon language on non-discrimination on abortion back into it, with a private right of action so that discriminated against providers can go to court, address that emergency services loophole by saying that the emergency services laws remain subject to respecting conscience. And of course that doesn't nullify the emergency services laws. It means EMTALA continues to operate to require Catholic hospitals as well as others to stabilize a pregnant woman and her unborn child if they need to be transferring it somewhere else, and to help to keep the condition from deteriorating. And then the conscience protection comes in and says the government may not step in and declare, contrary to what the medical professionals on the ground are doing, may not declare that they're violating the law because the stabilizing treatment they're providing is not an abortion. So they work hand in hand. They're in harmony that way. EMTALA was not designed to say you have to provide a particular procedure. They leave that generally to the doctors. Now this act was approved by the House Energy and Commerce Committee, is being prepared for House floor vote, as is the No Taxpayer Funding for Abortion Act, the Smith-Lipinski bill. That's largely concerned with creating permanent Hyde Amendment, permanent ban on federal funding throughout the federal government. So that it's not just, right now we're keeping the federal government from funding abortion by literally a dozen different riders and different appropriations bills across the entire government. And this would take them all together and say, this is policy, and we don't have to reapprove it every year. But it also takes the Hyde-Weldon Amendment and makes that permanent as well across the government. So that would be it's a very ambitious bill. It's been approved in committee. We think it'll get through the House. The Senate is a much bigger challenge, as is the White House. And the Abortion Non-Discrimination Act, H.R. 361, this would put the Hyde-Weldon protections permanently into law by amending that underlying section that's already permanently in the Code Snow Amendment. And it would add that private right of action to go to court. It would make it clear that if a state receives federal funds, every part of the state is covered. And this is a special, an act of special interest to me because it deals totally with the conscience issue, totally with just clarifying, making permanent, reaffirming something that's already been in law since 2004. And Pollyanna that I am, I even have hope that we might be able to pass this one in this Congress. But we'll see. We're getting some unusual co-sponsorship from Democratic congressmen from California who are generally not with us on the abortion issue, have decided, I am with you on conscience rights. And that's thanks to great efforts by the bishops of California and by the Alliance for Catholic Healthcare in California. So this one, I'm actually hopeful that this one could pass more readily than some of the others in the short term. And finally, Respect for Rights of Conscience Act. This is the Fortenberry bill. I think you'll be hearing more about it. There's a one-page fact sheet about it at the end of your handout. This also amends the Health Care Reform Act, but it says that these mandated benefits lists, whether essential benefits or preventive services, cannot be used to override moral or religious convictions. And health plans under the Act may not be required to discriminate in that way by these lists of mandated benefits. So it basically restores the status quo. It leaves people as free as they are now to negotiate a plan that respects their values with a health plan. Just as the bishops' conference now, you know, we negotiate a health plan that excludes all the things that are objectionable to Catholic teaching. And no governmental body is stopping a plan from taking our money and giving us that plan. But if these mandated benefits lists go into effect without conscience language, that's exactly what will happen, is that nobody will be able to sell us a plan that actually conforms to our moral and religious beliefs. One of the great ironies in the Healthcare Reform Act is that it has provisions for respecting the religious freedom of the Amish, who opt out of the healthcare, federal healthcare altogether, respecting Christian Scientists who want to be healed by prayer alone, and respecting Native American shamans who want to treat behavioral health problems in Indian children with traditional tribal practices. There just isn't anything in there for Catholics who run a sixth of the healthcare system. Yeah. So if I can ridicule enough people in Congress, maybe we can get this one through. Closing thought from Thomas Jefferson, who was no friend of Catholics, by the way. No provision in our Constitution ought to be dearer to man than that which protects the rights of conscience against the enterprises of the civil authority. It's nowhere more true than today. Thank you very much.